And speaking of health news, new tonight here in The Current, an Illinois pilot program is coming to our region. The Health Equity Zone Pilot Program gives money and technical assistance to communities. And the money is then used to discover, plan, and implement solutions to high priority health inequities. And the Henderson County Rural Health Center is now getting nearly $114,000 to address public health throughout McDonough County. And Jennifer Laymen was the woman who wrote the grant application that made it all happen. Jennifer, thank you for being here with us.
Thank you for having me on.
Why don't you break this down for us? Who's getting this money and where is it going?
Well, it's collaborative effort. So Henderson County Rural Health Center is collaborating with the McDonough County Public Health Department, WIRPC, the Extension Office, and the Western Illinois University. So we've all got some hand in the roles that we're playing as far as gathering the information that we're going to need.
And so what kind of information are you looking for?
Well, McDonough County Public Health does what they call an I-plan every 3 years, and it's public health data that we will be using to really drill into what their priority health measures are. We're also going to be conducting focus groups and interviews with community members who have lived experience with the issues that we're going to identify so that we can really get an idea of what the barriers to care are.
Jennifer, it sounds like you're just looking to figure out what sort of health challenges are most pressing in this part of Western Illinois and then how you can address them.
That's absolutely right. But with this grant, the lovely thing about it is that we get to do that on a very local level. Sometimes grants have you spread out services across a wide area, which kind of dilutes the efforts. And I feel like by concentrating specifically on McDonough County by itself, we're going to be able to make some great inroads.
All right, so I know you haven't done the studies just yet, but I mean, from your
No.
experience, what sort of health challenges are most pressing in McDonough County?
Well, their last I-plan identified the areas of obesity, mental health, oral health, and one more, mental health.
Okay, so mental health and dental and obesity are up there. So
Mhm.
whether it's
Oh,
this,
and sexually transmitted diseases actually was the other one. I remember
okay,
now.
okay. So when you get the results back from this study, what happens next?
We design a plan in which we will identify strategies that we can implement to make some kind of difference. And that'll be part of our data gathering. That is what we want to know is which needles can we move that are going to make a difference. The grant goes through the end of June, and this portion of the grant is strictly planning. So we have about 6 months of planning. And then after that, hopefully the legislature is going to allocate some more money for the implementation phase, but that is not a secure thing yet.
All right, before I let you go, Jennifer, in a perfect world, let's say you get the grant money. When you look at what's needed in McDonough County, Henderson County, even parts of Knox County, what would you say would benefit people the most to have health-wise in this area?
Better access to mental health care providers and oral health care providers. There's just a shortage of both right now. It's difficult to find people, even if we have a project like this. It's difficult to find the people who can fill those shoes of the services that need to be implemented.
Well, Jennifer, we thank you so much for your time today, and we're looking forward to seeing the results of this survey come hopefully this summer,
Yeah.
this fall.
Okay. Thank you for having me.
If you guys at home want to share this story, you can check out our online version at WQAD.com. Just click on the As Seen on TV tab.